डॉक्टर्स कहते हैं बीमारियों से हॉस्पिटलाइजेशन हेल्थी बच्चों में भी हो सकता है। वैक्सीनेशन से उन्हें कई गंभीर बीमारियों से लड़ने की इम्यूनिटी मिलती है, इसलिए उसे वैक्सीनेशन कार्ड का हर वैक्सीन वक्त से दीजिए। आपका एक फैसला आपके बच्चे की जिंदगी बदल सकता है। फैसला सही, जिंदगी सही।
Vaccinations play a crucial role for a healthy and disease-free childhood and development of your child. Here you could see Kareena Kapoor Khan also encouraging parents to ensure that children are up to date with their vaccination status beyond infancy. Hello everyone and welcome to today's live session brought to you by GSK and FirstCry Parenting. My name is Mannat and I'm the mother of a 6-year-old and the co-founder of the YouTube channel Get Set Mom. Our topic for the day is H3N2 flu, the disease, its impact, and prevention. And joining us for today's discussion, we have two eminent doctors who are going to talk to us through about this and also shed light on flu vaccinations and their benefits and much more. Also, viewers, I know you all have been enjoying these sessions and your participation means so much to us. So like always, please start dropping in your questions in the comments so the doctors can answer all your queries. I would like to welcome Dr. Prasanna M, who is a pediatrician joining us from the city of Bangalore, and also welcome Dr. Rajesh Khanna, who along with holding an MBBS degree is also a doctor of medicine and is joining us from Hyderabad. Welcome doctors, we are so glad you could join us today. So let's start off with the first question going to you, Dr. Prasanna. What is H3N2 flu and how does it spread?
See, H3N2 is a type of influenza A virus. There are mainly influenza A and influenza B virus. There are C and D are there, but it is not very important in human being. So we are mainly faced with the A and B. So H3N2 is one of the type of influenza A virus, which is usually present in pigs and agricultural animals. But those people who are in contact with these animals, they get infection first. From there, they will spread to other people. When it comes to the human being, it is called variant influenza virus. That is H3N2. Now, this is in the news for the last few months. Unfortunately, we have seen more cases of H3N2 in 2023. Now, how does it spread is just like a COVID virus. You know, in COVID, we all took COVID appropriate behavior. Same behavior we have to follow now. That is, whenever we tend to cough and sneeze, we have to close our nose and mouth. That is most important. When you are going to any public area, please wear mask. Otherwise, somebody will be coughing. So we have to protect ourselves. Then we are all worried, we know about the social distancing. And main thing is whenever you touch any surface, best thing is to wash your hand. But everywhere there is no soap and water. At least you should use the sanitizer, because everybody now we are used to carry the sanitizer. I still request everyone, please carry on doing the same behavior. This COVID appropriate behavior is very, very important. Now, fortunately, when we had COVID last 2-3 years, the incidence of influenza has gone down drastically. That is because same preventive measure for both the virus. So just to follow the COVID appropriate behavior, then you will reduce the chance of getting influenza virus. That is very, very important. And also one more thing for the parents, if a child is having any symptoms, better not to send that child to the school, because when they're having symptoms, they will spread this bug to the other children. So most important is they should stay away from the school, at least for when they're having symptoms, better not to go there, at least for 5 to 7 days. That is very, very important. Otherwise, other children will be at risk.
Thank you for that, Dr. Prasanna. Absolutely right. If your child is showing any symptoms, please keep them away from school, because schools, it spreads like wildfire, and one by one the children get it, and then it's quite a bit to handle for all parents. Thank you for that, Dr. Prasanna. Coming to you now, Dr. Rajesh. What are the symptoms of H3N2 flu and how severe are the complications from the same?
Yeah. So H3N2 flu is nothing but a viral infection. So flu is like a shortcut, like a short name given to influenza disease. So H3N2 is one of the variants, so one of the subtypes of the influenza virus. So influenza, as like any other viral infection, can cause high-grade fever with body pains, myalgia, and body aches. Influenza presents with majority of the times with upper respiratory symptoms, that is running nose, cough, running nose, and sore throats, and some presents with severe cough and lower respiratory complications like pneumonia can happen, as well as ear infections can also happen. So basically, this overlaps with common colds. So how you differentiate, I'll answer in the next question. So basically, it's a viral infection and its flu is nothing but it stands only for the influenza, not just a common cold. It is unlike common cold. It has high-grade fever with body pains. That's most classical thing with running nose.
Thank you for that, Dr. Rajesh. Coming to you now, Dr. Prasanna. Who all are at risk of complications from an H3N2 flu infection?
So normally any child who is less than 5 years old, they are at increased risk. And when it comes to the old people more than 65 years. But recently, our main American CDC, they have reduced the age to even 50 years also. 65 plus, definitely they are at risk. And one more is the pregnant woman. These people, most of the time we don't be aware. Pregnant ladies are more at risk. And also this is very, very important. All the pregnant ladies should get influenza vaccine, because the first influenza vaccine we give at 6 months of age. And the baby will get benefit in the first 6 months if a mother gets the vaccine during pregnancy. One for a pregnant lady itself benefit, then for the baby also. So both are benefited. So that is very, very important. Then other is some people will have their immunity level will be compromised. For example, in children, they have some conditions like a cancer and they're getting chemotherapy. They are at risk. And there are some immunodeficiency conditions also. And in adults, one common is HIV. They are immunodeficient. And some people will have long-lasting chronic conditions. For example, asthma, diabetes, then some neurological conditions, and heart disease, congenital heart disease. They are at risk. These are the main groups.
Thank you, Dr. Prasanna. So parents, like you heard, Dr. Prasanna very nicely outlined the age groups that are at risk and people who have certain conditions are also at high risk. So that is a good thing to keep in mind. Moving to you now, Dr. Rajesh. For a mother, and I can say this personally as well, because I have my 6-year-old, sometimes she falls sick. I'm not sure how to distinguish between things. It's difficult to differentiate between the kinds of flu, be it H3N2 flu or swine flu, H1N1 or something else, or a common cold. Can you please help us understand the difference between the various types of flu and the common cold? Because this will really help parents out as well if they can distinguish between these somehow.
Yeah. So as I mentioned earlier, flu has now, for a common man, has become synonymous with common cold, but that's wrong. So common cold is different from flu. Flu means we only mean it's influenza. And in influenza, we have A and B. A is more common. In A, we have two more common variants, that is H1N1, that is swine flu, what we are calling H1N1. The other one is H3N2. Only these two are commonly seen. Now, whenever you get flu, always remember you will be having very high-grade fever with severe body aches, with little running nose and cough. But whereas common cold, it's more of respiratory. It's like you have severe stuffy nose, the running nose, cold is more. And cough is the next one. Fever is not very high grade and body pains you will not feel that much. The presentation means usually in children, they are not verbal. They don't tell that they are having body pains or anything. So irritable child with having some respiratory complications, running high-grade fevers, we suspect flu. And the difference between common cold and flu is just a severe form or a serious form of common cold. So influenza child, attack child will be little more sick, and like the manifestations are severe, and if not treated, the child deteriorates rapidly. So child's hydration status has to be well taken care. So that's a easy diagnosis to have with differentiating between common cold, because common cold can be like delayed for a day, 2 days, 3 days. You can wait, simple basics, some saline nebulations and all that. So some sort of basic home care can work, but influenza is very severe. Like the child visit with the pediatrician is mandatory in such cases. You cannot take chance with influenza. So whenever child is running very high grade fever with these respiratory symptoms, do visit pediatrician, and compulsory pediatrician examination is required for this flu.
Thank you, Dr. Rajesh. So parents are exactly on point. The severity of the symptoms will also determine if it's influenza or not. And your pediatrician is the right person to tell you and guide you. So that's the first person you need to contact and consult and follow all the treatment and anything that they are saying. Thank you, Dr. Rajesh. Coming to you now, Dr. Prasanna. Flu infections is regularly reported and raises concerns among mothers who want to keep their kids safe, and we'll do anything for that, of course. So is this preventable, and is there something that the mothers can do here with regard to it?
Yes, this is a good question. See, it is preventable. The most important is all the COVID appropriate behavior, which I already mentioned. Better not to repeat the same thing. That is very, very effective method. Now, another effective method is we have a vaccination, but it has to be given every year, because this virus is very smart virus. It is fooling us every year. We are giving this vaccine so many years, but unfortunately, this virus is also smart. We are also smart. So this chase is going on. So every year we have to give the flu shots, and it will cover for at least 1 year. But again, next year we have to give the vaccination. Now, interestingly, because we are fed up with this vaccine, every year we have to give, it is still in the research state. Now, people are coming up with something called universal influenza vaccine. It is still in the pipeline. I hope they may get a success. If they get a success, then that will be a breakthrough. Then only 1 or 2 injections for lifelong. Like other vaccines, we don't give so many vaccines. Every year we don't give. This is the only exception. But people are also fed up, and they have come up. The idea is very good, and it is already in the pipeline. I was told they are getting a good result. Let us hope and wait. They get a success.
That's fascinating. We're going to keep a watch on that. It'll be very interesting to see the development.
Till then, we have no option. Every year we have to, at least the first 5 years. And even in the school going also, we are advising vaccination every year. That is because sometimes what happens, this COVID is also on the rise now. We are saying that we are reporting more cases of COVID. If child gets flu infection first, then if they get a COVID infection, then the damage will be more. But the flu, there is a vaccine available, which we can give it in the children. But the COVID vaccination, we don't give it. Up to 12 years, still it is not streamlined. So we are left with only annual influenza vaccination and all the COVID appropriate behaviors, which we are all aware. Everybody is expert now.
Yeah, I think through COVID, we learned quite a bit on the etiquette to follow. You're absolutely right about that. Coming to you now, Dr. Rajesh. Does the flu vaccination protect only against H3N2 flu or even any other seasonal flu? Dr. Rajesh.
Yeah, I think that we should not keep highlighting H3N2 just because these days we are getting some cases of H3N2. Basically, flu vaccine, nowadays it's a quadrivalent vaccine. which covers H1N1, H3N2, and influenza type B also. So it covers 4 variants of influenza virus. These virus strains keep changing, as sir rightly mentioned. So we need to take these vaccines yearly. So now this vaccine will cover only against the strains which are incorporated in the vaccine which you are giving. Any change in the strain or any other strains or any other virus apart from this, we don't expect any protection. So for influenza itself, we are forcing the child's parents, or we are recommending them to come yearly because the strains are changing. You cannot expect protection for the latest ones. So you cannot expect that this one shot of flu will protect against all other types because flu means only influenza, not other. So seasonal flu means we are focusing only on influenza. And in influenza, as I'm emphasizing, H3N2 is only one variant. So current vaccine is a quadrivalent. So H3N2 is very much incorporated in it. So you'll get protection not only from H3N2, from the other variants, from the other 3 variants as well. So you should stay up to date with the strains by getting vaccinated yearly.
Thank you for that, Dr. Rajesh. Coming back to you now, Dr. Prasanna. What are the peak seasons of flu in India per se?
See, in India, there is no doubt. It is, we see at peak is in rainy season, monsoon season throughout India. Usually, most of the parts of India, we get monsoon from June, July, August. There are exceptions. The Tamil Nadu, they get in little bit later, September, October, November, December. But peak season is rainy season. But we should be ready before the peak season starts. So ideally, it is mentioned at least 2 to 6 weeks. On an average, 4 weeks before the peak season, we should be ready with the vaccination. So any vaccine, this influenza vaccine, better to give it April, May, so that we are ready for the June. Most parts of India, to keep it very simple. And this vaccine is available twice a year throughout the world. We get it in April. So this year we got the news batch that is meant for all the rainy season which is going to start. That is called the Southern Hemisphere SH strain. So to keep it very simple, in India, most of the parts except Tamil Nadu, we should get vaccination during April and May, so that peak season starts in June, we should be ready. And the Tamil Nadu people, we should give it maybe August to September, something like that, because it starts in October, rainy season there.
Thank you for that, Dr. Prasanna. So if there are something like 2 flu seasons in India or 2 different times, even depending on the location that we are giving it, why the single annual flu shot needed? My next question to Dr. Rajesh here.
Yeah, I'll clarify this in detail. So this is a kind of influenza paradox, what we can call, because geographically, if you see, India falls into northern hemisphere kind of according to the equator, but still the strains, according to the strains and our monsoon climate seasons, what strains are prevailing. So India is rightly fits into southern hemisphere category, except for 1 or 2 zones, as sir mentioned. So in Chennai, some places in country, remaining rest of the country fits very well with the southern hemisphere, because majority of the places June, July onwards rain season starts. So before monsoon is the right time to get the flu shots. So April, May, in which southern hemisphere is released, and that's the latest one at which it is available. So April, May is the right time to take the flu shot, during which you have only one option, that is southern hemisphere. Whereas northern hemisphere category influenza shot is released in October, which is much delayed for us, and you cannot wait for it. And the strains are different. What southern hemisphere carries, what northern hemisphere influenza vaccine carries. So it's all from the WHO guidelines. Everyone should follow according to it. So when majority of our areas are well covered with Southern Hemisphere influenza vaccine. So it's wise to take it in this April-May season only. And you need not repeat the shot in October again, taking Northern Hemisphere vaccine. Why? Because you are staying locally and you are well protected against the strains which are being spread in the local area. The question can be typical, like you stay from May till September in one area and you're traveling to the Northern Hemisphere zone. And what if I go there and will I require? See, the area in which you live for a longer period, you're residing there, you need to stay protected for those strains in that particular area. So the answer is simple. If you are staying in one particular area, irrespective of the number of seasons in a particular year, if April, May shot is done, even if it is delayed, need not worry, take it as early as possible at the earliest, better late than never. But every year, why? Because the strains are changing. Again, next year, again, April, May on, you need to stay yourself updated with the latest, get yourself shot, the latest influenza shot.
Thank you, Dr. Rajesh. Dr. Prasanna, between the both of you, you fairly highlighted exactly what is the right time to take a flu shot, and it depending on the area you're located and the location you are at. But how do we keep a track of the child's annual flu shot and know, that the right time to take it? And how do we keep a track of the same, Dr. Prasanna?
Good question. See, now most of the pediatricians also go digitally. They have a system. Most of the in the public sector as well as in the private sector. In the corporate hospitals also they have a system. They all digitally, and they get reminders before the vaccination. And if parents want to, there are so many websites also. One common is myvaccinationhub.co.in. That is also will give the reminder. Basically, it is digitalized now, and they get SMS. So all pediatricians follow this. And so there's, and also in the book also they write that sometimes we forget to see, but mobile phones, they get a reminder. So all pediatricians have their own system, which is easily available.
Thank you for that, Dr. Prasanna. Absolutely right. Technology is always on our side here. So you will get an SMS, you will get a WhatsApp message, you will probably get a reminder on your phone. There are many ways to keep track of the time the shots have to be taken. So that's a good aid here. Coming to you now, Dr. Rajesh. Will children get flu or fever after receiving the flu shot? And is the flu shot painful, Dr. Rajesh?
Yeah. See, vaccines, anyways, parents are very eager that whether it is painful or painless. So majority of the vaccines which are given nowadays, they're painless. Just let's be very clear on the word. It's painless, not pain totally free, because when you're using the needle, definitely it will give pain at that point of time when you're injecting. But it's the after effects of what we are talking. So the residual pain, what we're talking, will be very, very mild or minimal. So maybe slight aching on the injection site, otherwise not much side effects, after effects you see with this. Very rarely some may feel some feverish, some low grade fever or some body pains, but that's very, very, very rare that you get such symptoms. So stay fearless, come forward to take the vaccine, because it is very easy to take these shots. You will not get much pain after that, and fever is less likely to be expected. So no need to worry to take this shot.
Thank you, Dr. Rajesh. We're going to move on to audience questions now. There's a whole list of questions that has already flowed in. So I'm going to start off by asking the first question here to Dr. Prasanna. A parent here has a concern which says, my baby's vaccination is scheduled on the 7th of May. But can I vaccinate this week, 10 days prior to the scheduled time? Is that possible, Dr. Prasanna?
10 days, it depends on if it is first 6 month completed. That is very important. 6 months should be completed. Then second vaccine should be minimum gap is 1 month. Now let's say after 1 year, if this date is given, then no problem. I don't know which month she is talking about. 6 month, 7 month, we should be very clear. 6-month completion, and from that day onwards, 1 month completion. That is the first and second dose. Then every year. That every year, that can be taken 1 or 2 weeks early, no issue.
Thank you, Dr. Prasanna. So, mom, dad, whichever one of you has asked this query, really depends on how old your baby is, like you heard the doctor, right? And then depending on that, if you can move around this schedule. So keep a track of that and consult your pediatrician, please. Moving on to the next question here, Dr. Rajesh. I have missed my baby's vaccination. What should I do now?
See, it's like I say, insurance policy kind of thing. You take a vaccine today, you are protected from today. You are taking a month later, so the date from which you take, you are protected from that day onwards. So, but vaccine can be delayed, should not be denied. You can take anytime whenever you remember, but some vaccines, yes, there is a different kind of catch-up schedule which pediatrician will have to sort it out how to schedule your missed doses, because there are specified intervals at which it has to be given. But remember, just missing the date doesn't mean that you are just at liberty to forget and forego that particular vaccine. Never ever do that. All the missed vaccines, missed doses, definitely visit pediatrician and schedule them accordingly. Even if it is delayed, let it be started. Better late than never. So don't delay further. Visit the pediatrician immediately. Need not worry about the missed due dates. You can still take the vaccine. Nothing to worry about that. No harm in that. But yes, better don't delay. Better don't delay, because as I said, it's like an insurance policy. You are giving protection that from the date onwards, the child is protected from the wild viruses and bacteria. So a lot of pathogens, lot of strains, they are changing. If you delay, the strains will also keep changing and protection rates will come down.
So parents, like you heard Dr. Rajesh, even if a vaccination has been missed, there's always a catch-up schedule. There's always a way around it. And don't think that just because you've missed it, you don't need to do it. It can be managed and can be handled. Please consult your pediatrician at the earliest and make sure that your child is vaccinated. And now moving on to the next question here to Dr. Prasanna. My baby's vaccination is due. Is vaccination necessary during a crisis, probably like this flu that is ongoing? Dr. Prasanna.
Yes, when vaccination is necessary, no doubt. Especially so when there is a flu season. Flu is everywhere now. So better to vaccinate early. No thinking back. Otherwise, baby will get it. It's a matter of time. When vaccine is there, better to protect ASAP. If it is due, you get it done. That too, especially when there is a flu season. So now main thing is, what is the purpose of this vaccine? We should prevent it. So all these preventable conditions due to vaccine, that should be prevented. We should not suffer from it. So please go ahead and take it if flu vaccine is due, right time. Don't delay, because flu virus, as I told, it is a very smart virus.
Yeah, as continuation of that, what Sarah has said, so just avoiding the crowd, thinking about visiting the hospitals, thinking that you are at risk with visiting the hospitals. You are as equivalent at risk visiting shopping malls, theaters, public places, going outside, going to the parks. So wherever you go, the virus follows you definitely, and it will not leave a single person. Those who are vaccinated, they only are staying protected. Those who are unvaccinated, definitely they are at risk. And the concept of vaccination and immunization is that the larger the population is vaccinated, the better is the protection rates. You will get that kind of herd immunity kind of thing. So some diseases, you will get better protection when people in and around are also equivalently protected. So like one person, my neighbors, let them not get vaccinated, I only can get vaccinated. So you don't motivate them, don't talk them. You cannot stay individually protected. You should motivate others and equally make them participate in vaccination programs. And regarding the visiting the hospitals, these days, like we are scheduling the appointments accordingly. We are not making our places overcrowded. So you can schedule your appointment properly and visit on time. Just finish off your job and you can go. So there is no much waiting time. So even if that you can schedule, and we are also maintaining vaccination days separately, and we are scheduling appointments accordingly. So no need to worry about that. That's not an excuse for you.
Thank you, Dr. Rajesh. So, you heard that right. Your appointments are being scheduled so that there's enough time gap between patients coming in. Your time at the hospital or at clinics is being minimized, and appropriate measures are being taken to protect children or the parents coming in to make sure that they don't get an infection or anything of the sort. So these are not, if you are concerned, you have a right to be, yes, but not so concerned that you avoid a vaccination altogether. It's much better to go and get a vaccination, protect yourself, and get that done. Staying with you now, Dr. Rajesh, for our next question. A parent here has a query. Can you please share vaccination details for a 7-month-old baby? What vaccinations will my 7-month-old baby require?
Yeah, that's a flu shot indeed. The second dose of flu shot. So usually you are on time, finishing all the previous vaccines, the 6, 10, 14 weeks and the 6th month flu shots. So you are now due for the second dose of flu shots. So if you have missed the 6 months flu shot, this becomes your flu shot number 1, and you will take second dose 1 month from now. So that's about the 7th month flu shots. And typhoid conjugate vaccine now approved from 6 months onwards. If not taken at 6 months, you can equally opt at 7 months, both flu and typhoid. Discuss this on one-on-one basis with your regular pediatrician. So pediatricians will schedule accordingly. So that's about the schedule of your 7 months.
Thank you, Dr. Rajesh. I think we had another viewer who popped up a question post this, which seems to have been covered in your answer. They had asked, according to new guidelines, at 6 months, the baby needs a vaccination for their first dose of the flu vaccine and any other vaccines recommended at this age, which I think you pretty much covered with your answer to the previous question as well. Thank you, Dr. Rajesh. Coming to you now, Dr. Prasanna. Will giving flu vaccinations every year decrease the immunity of the child?
No way it will decrease the immunity of the child. Now, immune system is a very interesting stuff actually. It will take any number of vaccination. Someone mentioned commonly in pediatric practice, all the vaccines, we have around 160, 170 antigens we are exposing to the child. And we have a very intricate system. It will produce the immunity in a nice way. No way it will reduce the immunity of the child. Even the immune system needs a kick. So vaccine is one type of kick. So we should vaccinate. We should keep the immune system charged. It is good for the child. So there is no decreased immunity in the child. No way.
Thank you for that, Dr. Prasanna.
Yeah,
so
I can.
Go ahead,
Excuse me. I can add some points also. So see, if you're not taking the vaccines or you're not poking your immune system, and you do, even then nature will not leave you. There are wild viruses, bacteria which always pokes you, so that keeps entering the body. What happens is, see, this vaccine fundamental itself, you are taking a shot and to stay protected. How? Because we are injecting a killed one or the live one, so we are boosting antibodies in your body, so that when wild virus or bacteria enters, your immune system is now familiarized to tackle that. You have enough antibodies now, which usually wane over a period of time. Some require boosters. Now influenza, the strains are changing, your body cannot recognize the new strains, so you are again exposing your body to, so you are familiarizing your body much before the wild virus gets into your body. So it is familiarization. Your body gets familiarized. You are trying to boost your antibody levels. It's not the concept of reducing your immune system at all. So we work scientifically, and we that's why we practice like that. So it's an evidence-based medicine. So you need not worry about that.
Thank you, Dr. Rajesh. I think you both covered that fairly well, that you need the vaccination to give a kick to the immune system, and then to train. The vaccination is necessary to train your immune system to fight the disease when, if you ever get infected by it or anything like that. So it's familiar with how it works, and then it knows what to do with it later. But thank you so much for that answer. Moving on to the next question here, and sticking with you, Dr. Rajesh, for this. Today, my 2-year-old daughter got a vaccination, and after that, she is crying a lot, and there is a lot of redness there also at the spot. Please suggest what I can do about it.
Yeah, see, whatever vaccine produces some local reactions, they can easily be handled by some, like you can just apply some amount of ice pack over there. So, or to lessen the pain, and you can even administer some paracetamol, but usually they are self-limiting. Even if you don't do anything, it disappears. But if the child is crying really a lot out of pain and the swelling is more, you can take the help of using paracetamol or some local application of this ice. But what I suggest is like this is all individual perceptions, the child to child perception varies, because the same vaccine given to one child will not have any sort of reactions that we don't, when fever is really expected from such vaccine, they don't get fever. So it's all varied. So it's that individual sensitivity. Your child is like little more sensitive, oversensitive to this. So need not worry about that. It disappears in a day or two. So just stay calm and give some, like, let the child be diverted. And if the child is really having pain, you can take the help of paracetamol after consulting with your pediatrician regarding the dosage.
Thank you, Dr. Rajesh. Coming to you now, Dr. Prasanna. My doctor asked me to give all vaccinations, but in the government hospitals, some vaccinations are not given. Then how do we know which one is important or which one is not? Please help me understand and clear my query. Dr. Prasanna.
Now, government doesn't have enough money. Otherwise, they would have given. That is the first thing. Now, my funda is very simple. If there is a vaccine to prevent any disease, better to go for it. Because some diseases may even cause death also. So government, from the India perspective, they have to think twice. Now, see, now pneumococcal vaccine was not available. Now, recently, last couple of years, they got money. Our economy is improving. Now, all the children in India are getting pneumococcal vaccine. That is a good thing. Now, government wish to give, but they don't have enough money. That is the main reason. So they will say, what is the priority wise in India? What are the vaccines they can cover? That they are already covering. But diseases are plenty and vaccines are also plenty. So that can be done only in the private sector. So government sector, the most important priority wise, what is relevant to the top, which causes really so much complications, pan India, they will, and which is cost effective. And people, India can afford. Those things they will, but it is a matter of time. We are in the right, our economy is booming like anything. It is a matter of time. India will add one vaccine, maybe in every couple of years. India's economy will improve, means they will add. It's a matter of time. But now, whatever is priority wise, that is what they can afford now. But still, there are rotavirus we are giving. That was not the case few years back. Pneumococcal is there. COVID vaccine they have given free. What else you want? Just wait and watch. We need a stable government and no any disasters, natural calamities. Then they will invest on this. It is just a matter of time. And one more thing, the cervical cancer vaccine, I think they've already tied up. That is another major advance. The cervical cancer vaccine only the rich people used to take before. Now government is also, I think they have not started, I think, or maybe they might have started. Pan India, they are going to give this vaccine. Then, in women, cervical cancer is the leading cause of death. So after this vaccine, we may reduce. In Australia, they almost wiped out cervical cancer after this, but vaccine is very costly. But so we have a pharmaceutical giant also. When they produce in so much in such a quantity, the cost will come down.
Yes,
And
yes.
this, we have so many NGOs also, this Gavi, this, what is that, Microsoft, Melinda Gates Foundation. They also will give some money to the government so that they can strike a deal with the pharmaceutical company and they get a vaccine for a cheaper rate. Pan India means we are talking about so many crores of vaccinations. So that is another achievement which is already they have signed a deal. It is going to come, cervical cancer. So, I mean, things are happening very fast, but there is always going to be a gap between government sector and private sector. And people are also smart. They will also add so many vaccines, isn't it? So this gap will exist, but it will narrow down. Don't worry.
Thank you for that, Dr. Prasanna. I'm coming to you now, Dr. Rajesh. Doctor, if the mother is on flu medication, then can this medication cause any harm to the baby if she feeds her? And any vaccination to prevent allergies in babies in case of this? Dr. Rajesh.
I could understand part of your question. So mother is on antivirals.
Mother is on flu medication. So can this medication cause any harm to the baby if she feeds
Yeah,
her?
if see flu medication means flu medication need not be antiviral as such. So basically, symptomatic and conservative management can be there. So usually, some if you have running nose, they are giving some antihistamine. So such medicines can cause some drowsiness to the baby. That's okay. But if you are really having the troublesome symptoms, you can still use at a lower dose. You just mentioned that you are lactating. Your doctor will adjust the dose accordingly and consider if it is really needed or not. So second thing is, yeah, antivirals, yeah, though they are considered safe, but still to be used with caution. Antivirals cannot be used left and right like that. Especially, we have to think twice when you are lactating. So we have to just keep a watch on what medicines you are taking. So otherwise, the basic flu medications what you are taking should not affect your baby. You until without the notice of the doctor, you cannot take. With the notice of the doctor, you can take.
Thank you for that, Dr. Rajesh. Coming to you now, Dr. Prasanna, for the next question here. My baby was vaccinated 27 days ago, but there is a lump on her leg and it's hurting when I press. What do I do? I'm worried that the vaccination was painless. Then why would his legs swell? And he also has fever for 3 days past his vaccination. Dr. Prasanna.
See, any vaccine, as Dr. Rajesh has mentioned, there will be a local reaction. One local reaction is just redness that will disappear in a couple of days. But if there is a bleed inside, so swelling may appear sometimes. That swelling, we may feel it for a couple of months also. Usually it does not cause pain. If you press a little bit harder, baby may just wince it. So now fever, everything will settle down in a couple of days. Redness will also settle down. Only that swelling, most of the swelling will disappear in a few days. But if it is a hard swelling, especially if there is a bleed, because while giving injection, child will not keep quiet. Sometimes child will move and there will be bleeding. There will be a clot. That will take a couple of months to disappear. But if you press very hard, the child may say there is a pain. That is very common. That doesn't mean they should avoid further vaccination. That site they can avoid. They can go a little bit up or down, something like that. That is very rare.
Thank you, Dr. Prasanna. Coming to you now, Dr. Rajesh. Uh, Are there any other vaccinations for 5-year-olds other than the flu? Dr. Rajesh.
Yeah. So that's a very important age, 4.5 to 5 years. You get boosters for diphtheria, pertussis, tetanus. That's a DPT shot, combining with injectable polio. So we have a combination vaccine as well, or you can give separately also. So diphtheria, pertussis, tetanus, polio, injectable polio, and chicken pox. If the second dose is not given 3 months after the first dose at 15 months age when you are taken, so this is the right time now to take the second dose of chicken pox. MMR, now see if that 15 months is given, and now preschool, you want it's a kind of booster MMR which you're taking. So along with chickenpox, MMR is given. So DPT, IPV, MMR, chickenpox. Typhoid earlier used to be given, now it's not given. So that mentioning 1 dose is enough. And flu is as usual compulsory once. Another one is meningococcal shots. So meningococcal shot, it's mentioned as optional thing. So you can consider discussing with the pediatrician, taking that as well. So basically, this is a phase of booster age. So you are what all vaccines given earlier, you are just trying to increase the antibody levels by giving the boosters. If the earlier vaccines itself they are missed out, then we have to plan the first doses accordingly. The catch-up schedule we have to plan. So based on the current previous immunization record, we have to plan accordingly.
Thank you, Dr. Rajesh. Coming to you here, Dr. Prasanna, is the flu vaccination compulsory for all babies? And if yes, till how many years of age?
Yeah, our Indian Academy of Pediatrics suggests it is compulsorily to be given from 6 months to until 5 years. Compulsory every year. As I told you, now we are giving in the school age also. That is because of the co-infection with the COVID. Because the flu we can easily prevent with the vaccination. Unfortunately, if a child gets the flu first, followed by COVID, then the damage is going to be more. So it is a sensible thing to give the flu shots even in the school going age, but compulsorily until 5 years. 6 months to 5 years is a must.
Thank you, Dr. Prasanna. Just to let both of you doctors know, we've had a lot of appreciation for this session, and there are comments that have come in. So I'm just going to read out a little bit to you. Thank you, doctors, so much for this informative session. You cleared so many doubts hovering in our minds, and we were glad to be a part of this session. And shall definitely share it ahead with my friends. Another parent says, thank you for giving me the perfect solution for my problem. That was a great discussion, and I'm sure the viewers agree, like we just saw as well, that we managed to absorb so much information from both you doctors and are leaving here understanding much more about the H3N2 flu, the symptoms to watch out for, treatment for the same, and about flu vaccinations and how they work and how they help our children and the ideal time to get them. It was a pleasure having you here with us, and thank you for taking out the time for this. Thank you, Dr. Prasanna and Dr. Rajesh. Viewers, if you have any other further questions, please post them in the FirstCry Parenting Q&A panel, and the FirstCry team will respond like they always do. Till then, thank you GSK and FirstCry Parenting for organizing this session. And viewers, a big thank you to you all for logging in and joining us for today's discussion. See you all next time. Bye-bye.
Okay, thank you.
Thank you. Thank you.
डॉक्टर्स कहते हैं बीमारियों से हॉस्पिटलाइजेशन हेल्थी बच्चों में भी हो सकता है। वैक्सीनेशन से उन्हें कई गंभीर बीमारियों से लड़ने की इम्यूनिटी मिलती है, इसलिए उसे वैक्सीनेशन कार्ड का हर वैक्सीन वक्त से दीजिए। आपका एक फैसला आपके बच्चे की जिंदगी बदल सकता है। फैसला सही, जिंदगी सही।